Welcome to the Health Balance Wellness channel, your oasis of peace. 6 signs of dementia and strategies to prevent it. Is your brain healthy, or could there be a little alarm bell? Today I want to talk about 6 signs of dementia that you should never ignore. This condition affects over 55 million people worldwide, representing the main cause of disability and dependency in the elderly, as well as being the 7th leading cause of death globally. You may be thinking, I'm still young, but it's important to know that changes in the brain begin decades before the first symptoms appear. That's why it's so important to pay attention. In this video, I will explore the topic in 3 parts. In the first, I will illustrate 6 early signs of dementia, often ignored or under-recognized. In the second, I will discuss 10 of the most well-known symptoms of the disease. Perhaps the forgetfulness you have noticed is one of them. Finally, in the third part, I will give you advice on how to prevent or slow the progression of dementia, and I will share the latest scientific discoveries, which are fueling new hope in research. We could be closer to a solution for this disease. If you or a loved one have memory problems, I recommend watching the video to the end. And if you find the content useful, subscribe to the channel, like it, and share it. But first, let's look at what dementia is. It's a general term for a series of symptoms that impair a person's cognitive functions, such as the ability to learn, remember, reason, concentrate, make decisions, and carry out daily activities. The brain is the guardian of our identity. It contains our memories, our emotions, our abilities. And that's where dementia strikes, gradually eroding the person until they lose their sense of self. It's not just about forgetting your house keys. It's a neurodegenerative disease in which neurons die at an accelerated rate compared to normal aging. It is important to know that dementia is not an inevitable consequence of age. One can live beyond the age of 100 with a clear and intact mind. But what are the different types of dementia? The most common is Alzheimer's disease. Next are vascular dementia, which is caused by problems with blood circulation in the brain, Lewy body dementia, which affected actor Robin Williams, and finally frontotemporal dementia, also known as Pick's disease, which currently affects Bruce Willis. The early postural signs of dementia can be difficult to notice, as they are often attributed to aging or a normal loss of muscle strength. However, some signs may be indicative of the disease. The step becomes shorter or slower, the person may start to drag their feet or show difficulty with coordinated movements, such as grasping a cup or using utensils. In addition, changes in posture may be observed, such as an increased curvature of the back or a tendency to lean to one side. These signs are subtle and often go unnoticed unless you pay close attention. People with dementia may begin to experience problems with their senses, but family members often don't notice right away. Common changes include difficulty with depth and spatial perception, as well as a reduction in their sense of smell and taste, which can affect their relationship with food and their surroundings. People with severe dementia may become sensitive to sounds, making it difficult to tolerate noisy environments, such as supermarkets or shopping malls. They may also experience hearing loss, which, if left untreated, can increase the risk of developing the disease. A study published in The Lancet found that hearing loss in adulthood is one of the main modifiable risk factors for preventing dementia. The brain, having to make sense of the impaired sound signals, experiences increased cognitive stress. If you or someone you know has hearing problems, it is important to intervene early. Sleep disturbances can be an early sign of dementia. These may manifest as increased daytime sleepiness, the need to take frequent naps, even if they were not usual before, insomnia, fragmented sleep, vivid nightmares, or restless sleep syndrome. The latter causes the person to move uncontrollably during the night, kicking, punching, moaning, or screaming. Restless sleep is not only a symptom, but can also be a cause of dementia, as I will discuss later. One of the earliest signs is emotional and behavioral changes. The person who was once active and enthusiastic about their hobbies and activities, such as dancing or shopping, now appears disinterested. They may stop attending family events, avoid company, and neglect their hobbies. Although apathy can be linked to conditions such as depression or anxiety, in dementia it is often the direct result of neuronal degeneration, which alters the neurotransmitters responsible for regulating mood. A very common early symptom is difficulty remembering the right words during a conversation. The person may substitute similar but inaccurate terms, for example, saying blouse instead of jacket, or forget the names of people they know well. This phenomenon, known as aphasia, was one of the first symptoms observed in Bruce Willis. Identifying these signs early is essential. The earlier dementia is recognized, the more it is possible to intervene to slow its progression and improve the patient's quality of life. Now that we have looked at the initial signs, let's look at the more advanced symptoms of the disease. Difficulty with short-term memory. The person remembers distant events, such as World War II, but cannot remember what he or she had for breakfast. He or she may also have trouble with abstract thinking and understanding numbers or symbols. Problems following conversations. Where previously he only forgot a few words, he now has difficulty following the entire speech. He may interrupt others because he loses his train of thought or fails to answer questions adequately. Mood and personality changes. Those who were sunny and affectionate can become easily irritable or depressed. Impulsive behavior, agitation, or an increase in distrust towards others may be noted. Difficulty making decisions. Even the simplest choices become complicated. The person may display poor judgment, putting their safety at risk, such as leaving the house without warning, getting lost in familiar places, or forgetting to turn off the stove. Loss of sense of time. You may lose the ability to recognize the day of the week or the current year, forget important appointments, or become confused by your daily routine. Repetition of questions. Even after receiving a clear answer, the person may continue to ask the same questions, due to the inability to retain recent information. Disorientation in familiar spaces. One obvious sign is getting lost in familiar environments, such as your neighborhood or even your home. Incorrect placement of objects. It is normal to occasionally lose your wallet or keys, but a person with dementia may put items in unusual places, such as putting your phone in the refrigerator or your watch in a sugar bowl. Hallucinations. In more advanced cases, the person may begin to see, hear, smell, or even taste things that are not there. They may believe they see dead people, hear non-existent voices, or perceive non-existent odors. Incontinence. One of the last symptoms is the loss of control over the bladder or bowel, an aspect that is particularly difficult to manage for both the patient and his family members. As dementia progresses, the person may lose the ability to recognize when it is time to go to the bathroom or forget to do so, leading to episodes of urinary or fecal incontinence. They may also have difficulty getting to the bathroom on time. In advanced stages, the person may completely lose self-awareness, not recognize their family members, have an altered perception of time and manifest more aggressive attitudes, as well as having difficulty walking. There are many causes of dementia. Although there is a genetic component, it is not the primary factor. Lifestyle, diet, and environment significantly impact the risk of developing the disease. Risk factors include head trauma, stroke, and chronic infections such as HIV. A recent study found that over 60% of people who had a stroke experienced significant cognitive decline within a year. Circulatory problems, such as atherosclerosis, alcohol and drug abuse, an unhealthy diet and nutritional deficiencies, particularly in vitamins B1 and B12, can also contribute to the onset of dementia. A study conducted in Finland has shown that interventions related to proper nutrition, physical activity, and cognitive training can help maintain brain function and prevent cognitive decline in elderly subjects at risk. To protect the brain, it is essential to build a cognitive reserve, which is a set of neuronal connections developed throughout life through education and complex activities such as learning a language, playing a musical instrument, or playing sports. A well-known study of American nuns showed that some of them, despite showing biological signs of Alzheimer's, did not show any symptoms of the disease. This result was attributed to their high level of mental and cognitive activity throughout life. Physical activity also plays a key role. It promotes circulation, protects the heart and brain, reduces stress, and stimulates the formation of new neural connections. Both aerobic exercises, such as walking, swimming, or cycling, and weight training are beneficial, as muscle strength is associated with a lower risk of dementia. To prevent dementia, it is important to stop smoking, as smoking damages the cardiovascular system and increases the risk of heart attack and stroke. It is also essential to control blood pressure and cholesterol levels, as hypertension and atherosclerosis can promote cognitive decline. Statin use has been shown to reduce the risk of dementia by 15%. Maintaining a healthy body weight is also crucial. Excess visceral fat causes inflammation, increasing the risk of dementia. Additionally, being overweight is associated with sleep disorders, such as sleep apnea, which can impair the quality of your sleep. Diabetes is also a significant risk factor. Alzheimer's has been nicknamed type 3 diabetes because of the changes in glucose metabolism seen in patients with the disease. Insulin resistance appears to be a cause of memory loss, as insulin receptors are concentrated in the hippocampus, the region of the brain responsible for memory. Studies have shown that administering insulin through the nose improved cognitive abilities in patients with Alzheimer's, confirming the importance of proper glucose metabolism for brain health. Quality sleep is essential to preventing dementia. According to researchers at the University of Rochester, during deep sleep, the brain activates a cleaning system that eliminates waste. Studies have shown that sleeping less than 7 hours a night for long periods is associated with increased accumulation of beta-amyloid and tau proteins, which are hallmarks of Alzheimer's. Diet also plays a crucial role. The Mediterranean diet and its MIND variant, rich in healthy fats from avocados and olive oil and low in refined carbohydrates, have been shown to benefit the brain. Additionally, the ketogenic diet, which promotes the use of ketones as an energy source, has been shown to improve memory and cognitive function in people with mild cognitive impairment or early Alzheimer's. The outlook for Alzheimer's treatment is changing. After more than 2 decades without significant progress, 2 new drugs, lecanemab and donanemab, have been developed in the past 6 months. Both are immunotherapies that stimulate the immune system by removing beta-amyloid proteins, reducing memory loss and cognitive ability in patients. Although these drugs are still expensive, they may become more affordable for early treatment of dementia in the future. If you found this information helpful, please share it to help more people learn about the signs of dementia and strategies to prevent it. Don't hesitate to contact your doctor if you have any concerns. Don't forget to subscribe to stay updated. See you in the next video.